good to have you back. Let's continue with our focus on International Nurses Day. Nurses make up almost half of the country's healthcare workforce. Health company Afrocentric Group's CEO Ahmed Banderker believes nurses are the key to accessible and affordable healthcare in South Africa. And he joins us now to outline plans to a more accessible health system, which he says starts, of course, with nurses. Thank you so much for your time, Ahmed. Good to have you. I saw your article titled "Nurses are the key to accessible and affordable healthcare in South Africa." The question is, how?
Good morning, Tamela, and good morning to your viewers. So firstly, I just want to say Happy International Nurses Day to all the nurses out there, and deep gratitude to them for the work that they've been doing through this COVID period, in fact. So absolutely, we've got a firm view that nurses actually can play a vital role in rolling out more accessible healthcare. I mean, the reality is that in rural South Africa, where we have most of our population, it's difficult for them to be able to access a doctor. One, there's the distance and there's the cost of transport for them to get to a doctor. And two, there's the affordability aspect of being able to afford the doctor's consultations. Whereas through virtual models with nurses, it could be a phone call away, a video call away, to be able to at least consult and get the basic level of care, which otherwise does not get attended to at all.
Yeah, and with that being said, I mean, it begs the question, why does, should I say, quality healthcare continue to sort of uproot and marginalize millions of South Africans in this country? Because I would like to believe that everybody has a right to quality healthcare.
Absolutely. So everybody does have a constitutional right to quality of healthcare. And if you look at it, you know, we have a skills shortage in the country, right? We don't have enough healthcare workers. And I mean, we need more doctors, no doubt about it. But that's a long process to be able to get them qualified, and it's an expensive process. However, people qualifying as nurses, it's a lot more shorter, it's a lot more effective. And I truly feel for them, because they really are the unsung heroes in this COVID pandemic, actually. To give you an idea, I visited the US not too long ago, actually, just prior to COVID, and had a look at some of their HMO models. And it's actually quite clear that they managed to get something right, where the first port of call is virtual consultations these days with nurses.
Yeah.
And if that doesn't work, or the nurse is not equipped to deal with that particular condition, it then gets referred to a GP. And they were giving me the statistics of how many consultations takes place for a GP, where the screening takes place through a nurse first before it gets to the GP. It means that they can get through so many more consults in a day, and people are treated faster and more effectively.
It reminds me of your care first, nurse first, if I'm correct. Care first, near first approach that you also talk about. But also when you mention technology and, virtual consultations, I then wonder, Ahmed, if it's feasible for the majority of South Africans who still experience the digital divide in this country.
Yeah, so I think we've seen a massive uptake, obviously, from a digital perspective. I mean, services like WhatsApp has become certainly the most primary used engagement tool, obviously. And even through WhatsApp, it's an engagement tool that can be utilized for a number of these type of consultations. So, maybe it's still going to be a lot more cost-effective for those. There's a bit of training for our older folk that might be in the rural areas, but it's still going to be a lot more cost-effective for them to engage through the digital channels than what it is going to be to physically get there. And look, one of these silver linings, Tamela, through this whole process of the COVID pandemic is that people very quickly became digital savvy, right, of doing video calls and FaceTime with their friends and grandchildren, etc.
All right, we'll leave it then. Thank you so much for highlighting this issue. Afrocentric Group CEO Ahmed Banderker for joining us.